Hi, John. Thanks for coming back in. I appreciate seeing you. How's this past week been?
It's been so.
It's been so-so?
Yes.
Still struggling with the fam?
Yeah.
Yeah?
Yeah.
Okay. Well, I had a chance to look at your assessment and I reviewed it with my supervisor, and there are a couple things that I want to go over because I think we put together a pretty comprehensive treatment plan for you. And while I'm discussing this, I want you to make this as much of your treatment plan instead of me just giving you ideas. If I'm off the mark, I want you to say, that's really not what I want to do. Can we try something different? Okay? So I've identified 4 things that we talked about out of your assessment. One would be the legal justice issues that you're facing, relationship issues, as well as substance abuse issues, and lastly, trauma and grief that you've experienced in the last few years, okay? So when it comes to legal justice issues, what I'd like to do is to explain to you how we're doing this. Your treatment plan has a main component and then 3 subsections underneath. Okay? These are the things that we're going to be working on the entire treatment episode while you're here. This is not something that you'll finish before you leave. It's just a continuum that we're going to work on, okay? So when it comes to legal justice issues, the first thing I want you to do and to continue working on is completing probation successfully. That's what we want. We don't want a rearrest, we don't want a violation, and we certainly don't want you picking up any new charges, okay? The second would be to provide urine samples when requested, and that's going to be random.
Come on now.
You have to do it for court anyway.
That's too many urine samples. One for court, one for here. Really?
Well,
We
that's
can't do nothing different?
That's only 2. The good news is when you're on the Codaphone and they call your color, if you're here that day, you can just drop here so you won't have to drop twice. Okay?
I guess, all right.
Okay. Just one little thing.
For how long I have to do that? As long as I'm in the program?
As long as you're in the program. Yeah.
How long you say the program is?
12 weeks
24 urines?
on the average, yes.
On the average?
Mm-hmm.
It could be
That'd
more?
be, not typically, but sometimes it could happen.
Yeah, okay, all right.
All right. The other thing is to attend all treatment requirements. You have to come to group. You can't be late. You can't call and say, oh, today I'm going to do the day and tomorrow I'm going to do the night group. You have to have a consistency. Because one thing that we're doing here is we're developing a time management plan so that when you're finished, you're in better control of you. All right? When you're in active addiction, your time management skills are poor because really all you're doing is looking for the next high. You're not worrying about your family. You're not worrying about your job. You're not worrying about anything else except for the drugs, and your time management goes out the window.
Well, can I do the units the same day I had a class? Because I can't keep running back and forth.
Oh, absolutely. I'm sorry. Yes, it's the same day that you have the class. I'm so
Okay.
sorry for that. I should have been more
Yeah.
clear. Yes, absolutely. The same day that you have class, you'll be dropping. I would never
Okay.
ask you to come back in on a day that you're not,
Okay.
okay? I'm sorry that I should have been more clear.
That was too hard.
Okay? And when it comes to your substance abuse issues, I want you to attend 3 12-step meetings a week. It can be NA, it can be AA, it can be HA, it can be CA, it can be agnostic, it can be whatever you want. But I do want you to understand and feel the community of the Alcoholic Anonymous, the Heroin Anonymous, the Narcotics Anonymous, the Cocaine Anonymous. I want you to understand the brotherhood, the community of it, okay?
That's for the full 12 weeks.
It
too.
is, yes. Like I said, this is something that we've been, we're looking at
Three classes.
36,
Meetings,
yeah,
urines.
yes.
When do I sleep?
Well, there's 24 hours in a day. Your classes are 9 hours for the week.
Oh,
You'll be dropping while you're here, so that would be within the 9 hours. The AA meetings, NA meetings are only 1 hour, so you're really only looking at, 12 hours a week right now. So there's
I try.
there's a lot. We can do this, okay?
I try.
I'm supporting you 100%. I know you've got this in you, all right?
Okay.
And then one thing that you and I are going to work on together is we're going to work on a relapse prevention plan. So when you leave, what's going to happen is you're going to have a little card in your pocket. And if something happens and you feel like maybe you want to use, you've got your little card you can look at what you're going to do, the first 5 things in your relapse prevention. Okay? It appears like it's overwhelming, but it's not, because we have 12 weeks to work on this.
What's on the card specifically?
Whatever you want in your relapse prevention.
Oh, okay.
Okay? This is as much your treatment plan as anything.
So I can put like call my friend.
Absolutely,
Oh, okay.
absolutely, absolutely. The other thing we're going to talk about is your triggers. What makes you want to use? What triggers you to use? And we don't have to talk about that now, but I want you to be aware of it so that when you get into a situation like that, you can fall back on your relapse prevention plan and not get into a jackpot again. Okay? We're really, really working on sobriety here. Okay? Next thing is relationship issues.
There's more.
There's more. There's only 2 more. Okay?
Okay.
There's only 2 more. When it comes to your relationship with your wife, when she's talking to you, are you just going through the motions or are you present with her?
She don't talk to me, she talk at me.
She talks at you? All right. Then what I want to work on here is I'm going to change this a little bit. It's called an I statement. Do you know what an I statement is?
No.
Okay. I'm your wife. John, I don't understand why you're doing this. I can't believe that you did this. You got the wrong Coke. I can't believe you did that. I wanted Diet Coke. You got Coke Zero. Instead of barking back at her, one of the things that you can say is, I'm sorry I got the wrong Coke. I was in a hurry. I was really stressed out from work. I can go and exchange it tomorrow. Because now you've taken it off of her ability to rebuttal and say, but you said, you just identified my I statement. I am feeling this way.
Okay.
And as you progress and becoming more comfortable with your I statements, then you can maybe talk about feelings. I don't appreciate you speaking to me like that. I would much rather have a quieter tone. Of course, that's going to cause an argument, but we're talking down the line, okay?
Okay, yeah.
And we'll have role play with you and I where you work on your I statement, and I can go back and talk like, okay? I want you to identify 3 people who have been supportive in your sobriety, but I also want you to identify what 90 days looks like for you regarding your children. What do you hope to accomplish with your relationship with them in 90 days? I know it's a struggle right now, but as we work through it, you're going to have a clearer sense of what you'd like to do the longer that you're sober, okay? And then lastly, trauma and grief. I am requesting that you seek mental health counseling to discuss your trauma and
I ain't
grief.
crazy.
Well,
Ain't well, like I guess you would.
well, here's the thing. Your trauma is different than my trauma, all right? I've never had...
You think I'm crazy?
Absolutely not. I think that you have to talk about what happened. I think you have to talk about your nephew. Okay, my nephew was not shot once he joined a gang and being in the wrong territory. My sister was not burned in a house fire, and I did not have to endure the burn unit at Metro, okay, and the things that you've identified. I've not had to do that before. Being able to talk to somebody who doesn't have an opinion about it, who will be able to guide you how to manage that grief and that trauma and to work through it. You know, there's 5 stages of grief: denial, anger, bargaining, depression, and then you accept it. And you're not out of the anger stage yet. You're still really angry about everything that's happened in the last couple of years. Absolutely. Then I want you to be able to identify the loss, your feelings as a result of your losses. I know you're angry, but there's a lot underneath it too that's bubbling up, okay? And lastly, I want you to understand what the 5 stages of grief you're going through. All of this is going to be with your mental health counselor, but it's a part of our treatment plan to make sure that you do what you need to do in order to stay sober.
You can't do this?
I could, but I always like to have a second set of eyes when it comes to mental health to make sure I'm on the right track. And if I need additional help, I can get additional help.
Okay, but you're gonna be the lead person?
I'm always the lead person. I'm your lead
Okay.
counselor, absolutely, okay?
Okay.
So,
I don't want no stranger.
well, no, oh my goodness, no. And a couple of times what I'll do is I'll have the mental health counselor sit in on our sessions so you get a little bit more comfortable being in the room with her so that you're not walking into a stranger,
Okay.
okay? How do you feel about the treatment plan we put together? Does this,
It sound good other than all the meetings,
yeah,
but
well,
otherwise it sound good.
yeah, and you know, when you go to the meetings, you'll become more comfortable and you'll be able to get phone numbers from people. And if you get in a jam, that might be somebody on your relapse prevention plan that you're going to want to call,
Okay. I
okay?
get it.
Did I miss anything? Is there anything that you would like to?
No, we can't add nothing else to the list.
Okay,
No,
okay,
we're good.
okay.
Yeah, that list is done.
All right, well, here, this is what I'm gonna do. I am going to have you sign and date for me, but I do have to tell you, if you cannot stay sober and you continue to use, you're going to have to require a higher level of care, which will be residential treatment,
Yeah, here we go.
okay?
Come on. Let me sign.
Do we,
I understand.
we
I
understand, okay? Sobriety is what we're looking for here,
Number one.
and being comfortable with yourself, okay?
It's gonna
all right.
work. We're gonna work this out.
We're gonna work it out, absolutely. All right, and I will sign it, and then I'm going to get a copy for you. And then, since we met before group, you'll go ahead and go to group, and we'll keep this schedule up where I'll meet you before group.
Today?
Oh goodness, no, I'm not gonna meet you again, but yes, you're going to group now. That's kind of why I do this, so that you're here and everything's taken care of in one fell swoop. You know, I don't need you stressed out anymore,
Okay.
okay? I need your time management, and I need your commitment, and you have my commitment that I will do everything I can as a counselor to make this a healthy transition to sobriety.
Okay.
All right?
You got bus tickets?
I do. I'll give you 2 bus tickets, one to get home and one to get back. All right?
Sound good.
Okay, thanks. All right, thank you.